Hi, this is an essential level workout of Pilates. Starting in parallel, ankles, knees and hips all stacked on top of each other. Lengthen the spine, drop the shoulder girdle down, and then transfer your body weight by swaying forwards and backwards through the ankle joint, into the heels and then forwards into the balls of the feet. As you sway backwards and forwards, you will notice your back muscles and your abdominals activate. We'll progress the sway forwards and back to heel raise, and as we arise, we'll float the arms just roughly to shoulder joint level. Thinking about the weight distribution through the feet, we're coming up towards the big toe, making sure we don't rotate out towards the little toe. Controlling the rise, controlling the lower. Starting to warm through those ankles and maintaining a lovely long spine. We'll make the next one our last repetition. And then working on keeping the pelvis stable, we'll peel the heel and float the knee, coming up into knee lift before releasing that down, switching to the other side. So you'll notice that you have a postural sway from side to side as you shift your weight onto one leg. That is absolutely normal, perfectly natural for that to occur. You move using the muscles in your thigh to lift the knee up, ensuring that you keep a nice long line here between the rib cage and the pelvis. So what you don't want to happen is you don't want to hitch the pelvis up in order to lift the leg up. You should be holding a nice neutral position with the pelvis and the lumbar spine as well as you're going into the knee lift, rather than using your pelvis, I'll just move my arms out of the way, to lift your leg up by tucking the tail between the legs and flattening the arch in your back. So your arch is really important for this movement, and you're working to preserve the arch. We'll make this our last one, and then we're going to work on gluteal strength with squat. I'll turn side on so you can see correct alignment. Sitting back into the heels, as if you were trying to sit down onto a chair that has been placed behind you. Now, by keeping your arms crossed, you'll be able to control the shoulder girdle, maintaining the engagement of your shoulder blades down your back. So the gap between the top of the shoulder and the ear stays long. With the addition of an arm, float into the squat. You're trying to keep the gap between the shoulder and the ear long, avoiding the temptation to lift your shoulders up towards your ears as you go down into the squat. So it's a nice long neck each time you go down. You'll feel the buttocks working. And we'll be moving from squat to reverse lunges. We'll go alternate legs. Just stepping back onto a nice straight leg as you lunge. Aim to keep the front knee pretty much above the ankle. As you're stepping it back, and if you think about keeping your weight in your heel as you're into those alternate reverse lunges, then that should help you maintain the knee to ankle position. You want to avoid pushing your knee forwards over your toes like this when you are lunging, as that tends to put quite a lot of pressure onto the internal structures in the knee. Last time to each side. And then we'll work on spine flexion with partial roll down. Imagine that you stood against a wall, keeping the pelvis and the heels against the wall. We'll peel forwards off the wall rounding into the upper back, mid and lower back. So our arms are dangling quite far away from our body, and it will feel like a stretch into the spine. We'll roll it back up. So with partial roll down, we keep the pelvis still. We work on spine flexion only. So we're developing our awareness of where our spine ends and where our pelvis starts. And you can do your partial roll down and learn what it feels like by actually standing against the wall. And then you can maintain contact between your pelvis and the wall as you roll down. Last time through. Lovely. Okay, we'll take it from the top and we'll make everything that we're doing just a little bit more challenging. So when we sway forwards and back this time, you can close one or both of your eyes. You may find yourself over balance. And you may even find yourself using a step strategy, either stepping forwards to stop yourself falling on your face, or stepping backwards to stop yourself falling over on your back. We'll make this the last time. And then we'll go heel raise, heel lower. Increasing the range of the movement of the arms this time, while still working on keeping the shoulder girdle down the back. Notice position of the feet. Keep working towards your big toe, avoiding rotating out towards your little toes. This time we're going to hold the arms overhead, release the heels down, and work our rope climb exercise, just stretching into the side of the body as we lengthen, 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 and lengthen for 4 and 3, 2 and 1. Come to center, release down. Okay, now we're going to alternate squat, reverse lunges. Okay, again, I'll turn side on so you can see what I'm doing. So we're going to sit back into a squat, come up, step back into a lunge, and up, sit back to squat. Change legs with the lunge, weight staying directly above that heel. Squat, and lunge. So a squat works the buttocks, and a lunge is very, very similar to a squat. Because there's very little weight that goes back onto that leg, your lunge is a little bit like a single leg squat. So if you get very good at it, you could potentially go into your lunge without touching your toe down to the floor. That might be something that you actually want to work on while you're working through these exercises over the coming weeks. We'll make this our last time through. Finishing on an even number. And then we'll do a full roll down. We're going to be moving into our plank position. So stand at the back of your mat, soften the knee if appropriate, peel forwards into your partial roll down, flexing into your back. Allow pelvic tilt to occur this time once you've got full spinal flexion, taking the hands down to the mat. You may need to bend your knees at this point to get your hands onto the mat. We'll walk into plank, and the first Pilates exercise we'll be working on will be our leg pull prone. So if you find that plank itself is enough of a challenge, stay here. If you find plank is too difficult, come down to a 3/4 position. And if you're ready for the challenge of leg pull prone, you're holding the position in plank to go into hip extension, ankle shift, return and lower. Extend, shift, return and lower. So as you lift your leg up, you want to lift high enough to feel the buttock fire, but not so high that you end up in a three-legged dog position. Aim to keep the head in correct alignment by performing chin retraction. One more to each side. And then when we finish this last one, we are releasing ourselves back into our shell position. Holding shell, soft breath in and out. As you breathe out, try to relax into the shell position, allowing the muscles to let go. One more cycle of breath in shell. And then we're going to position ourselves face down. I'm just going to bring my blocks to the other end of the mat. To work through our breaststroke prep sequence, place a small pad underneath your forehead so that you can hold your neck in neutral. Bring the arms to a W position, legs to parallel. Working on shoulder girdle, we'll slide the shoulder blades down the back, and then we peel the face and chest away from the mat. Release the chest and face back down to the mat, releasing the shoulders up towards the ears. The movement is depression of the shoulder girdle, followed by a gentle extension into the cervical and the thoracic spine, before releasing the spine and releasing the shoulder girdle. Sliding the shoulder blades down. Peeling the face and chest up. Releasing the chest and face down, releasing the shoulder girdle. Sliding the shoulder blades down. Peeling the face and chest up. Releasing the chest and face down, releasing the shoulder girdle. Breaststroke prep 1 really helps us to work on a movement that's called sternal lift, i.e. lifting your breastbone up. And this will help to strengthen the muscles that will stop you from hunching forwards and rounding into your upper back. We'll make this our last time through. And then we move into position for stage 2, taking the hands by the hips. We're performing a shoulder girdle retraction and a lumbar extension this time, before releasing the lower back and releasing the shoulder girdle. Squeeze the shoulder blades towards each other, float into the lower back, release the lower back, release the shoulder girdle. Squeeze the shoulder blades, float into the lower back. Release the lower back, release the shoulder girdle. Squeeze the shoulder blades, float into the lower back. Releasing the lower back, releasing the shoulder girdle. We'll work through this twice more. Making this our last one. And now moving into stage 3 position. So placing the hands underneath the forehead. On the breath out, we float up, and on the breath in, we float down. Adding load to the lumbar extensors as we ask them to lift the weight of not only the face and the chest, but also the arms. You can modify this one if you need to and leave one arm on the floor, but please work towards being able to lift them both. Making these your last 2 repetitions. And then when we have finished that last one, we are going to work on our push-ups. Hands under shoulders and keeping the elbows close to your body as you bend and straighten. This will emphasize the work into the triceps at the back of the arm. Maintain the chin in retraction as you work through your push-up. If you can, please do 2 more. If you've done enough, rest yourself down on your tummy. Well done if you did the extra 2. We'll move into position for cobra. We want to work with the legs abducted. Use the edges of the mat to take your feet to them. Start by extending from the top of the spine towards the bottom until you're propped up onto your elbows, and then release it back down. Keeping the legs straight across the knee joint, we're doing alternate hip extensions, and then we'll move back into that cobra extension. Releasing down from it, alternate hip extensions, and into the cobra. Hip extensions. Pelvis needs to stay in contact with the floor when we do the hip extensions. So if you think about those 3 bones at the front of the pelvis, the 2 hip bones and the pubic bone, they all remain in contact. What you need to avoid with your hip extensions is lifting your pelvis off the floor. That's spinal rotation, not hip extension. Or letting your knee bend. That's hamstring activation rather than buttock activation. Last time through. And we'll move back into our shell with a wide leg stretch position. Keep your feet close, but take your knees wide, sink yourself back to shell. Soften yourself down towards the mat, and that will feel like you've got a stretch into the inner thigh, as well as a stretch into your back muscles while you're sitting in your shell position. Breathing to release into it. Last cycle of breath. Moving from shell to 4 points, hands under shoulders, knees underneath hips. Moving the spine into flexion and extension with the cat stretch. The options are to move both ends of the spine simultaneously, or you can work segmentally from the bottom of the spine towards the top of the spine. And by working segmentally, it is slightly tougher due to the fact that you are working on your motor control. Last time through, sinking back into shell and taking this to the side. Crouching low to the thighs. Walk both of the arms around to one side until you can feel the stretch down one side of the body. Breathe to relax the muscles into the stretch. Using the out breath to blow the tension away. Let's move to the opposite side. One more cycle of breath here in and out. Releasing back to centre, and then we'll bring it into position for side bend prep. So if we come up via 4 points and take a quarter turn, your bottom leg's on the floor and your top knee's pointed to the ceiling with your top foot in front of your bottom foot. Our side bend prep takes us over, loading our shoulder dynamically as we stretch the spine laterally. We use the breath out as we stretch over and the breath in as we release it down. Last time through. Moving into position for side lying spine rotations. We bring the legs forwards. Prop your head up on something to help you maintain the neck in neutral. So you've got right angle at the hip and the knee, and let's do right angle at our elbow as well for the open door arm line. Reach to the ceiling or rotate the top of your body. Pause at the end point of the rotation, take a breath in, and breath out, return. Breath in, engage and reach. Breath out, rotate. Hold the end point, breath in, and breath out, return. Breath in, engage. Reaching the arm, breath out, rotate. Hold the end point, breath in, and breath out, return. This time we're going to hold the rotation. So we reach the arm, we rotate, and I would like you to stay here, focusing on your breath. Nice big deep breath in through the nose, breath out through the mouth. Breathing again, in through the nose, out through the mouth. Aim to get your rib cage to really expand, and then recoil with your breath. And you may well find yourself just sinking deeper and deeper and deeper into that rotation with each out breath. Final time through the breath. And then returning to your start position. Quad stretch on your side. Holding your top foot. Move your knee back in line with the hip. Tuck the tail between the leg. Try to open the hip, getting the knee a little bit further back if you can to challenge the length into those muscles. And release it from there. Side plank on the elbow. Push yourself up, so you're propped up, elbow under shoulder, and bring the knees back. Lift the rib cage, making the body into a diagonal line, and then come up onto the knee as you reach to the ceiling. Now this is the modified side plank position as you're lifting half of your body weight with it. If this is the right level for you, stay there. To make it just a little bit harder, you're going to extend your top leg, and you're going to stay there. To make it harder still, you're going to extend the bottom leg, and that puts you into your full side plank position, and you're going to stay there. 10 more seconds, counting down. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1, and release it down. Coming through to seated, we'll work either the eye to J, which is the modified form of the half roll back, and this may be more suitable if you are just recovering from any disc issues. If you're free of disc issues, you're going to flex your spine forwards, taking the spine into C shape. Exhale to roll halfway back and inhale to roll up. Ankles, knees and hip joints should be parallel to each other with this exercise. And we maintain the spine in C shape. The exercise is an inner range rectus exercise. So the rectus abdominals are flexed and they stay flexed. So you've locked your rib cage onto your pelvis. You've reduced the lumbar curve. You may feel a little bit of stretch into your lower back muscles. And the actual muscles that are moving with this exercise are the hip flexors as they pay out to lower you down. Twice more. And then last time through. Now our next movement pattern is similar to our roll down, especially the prep phase of the roll down when we're looking for that isolated spine flexion. And this is the spine stretch forwards exercise. I'd advise that you sit yourself up onto a book or a hard block if you've got one. You need to have your spine sat in neutral to begin this one. So neutral spine, ear, shoulder and hip joint on a straight line with each other. And it should be a vertical straight line. I would not like a diagonal straight line. So you're sitting up straight. Here's a little tip if you want to know what this actually feels like. Sit against a wall. So if you sit yourself against a wall, getting your pelvis to touch the wall, your shoulder girdle to touch the wall and your head to touch the wall, that is how difficult it actually should feel to sit upright. And that is the position that you are trying to achieve as you start point for your spine stretch forwards. So we have our hands on the mat and we start to flex the spine from the top, working in sequence towards the bottom. And then we restack from the bottom of the spine towards the top, coming back to seated neutral. Use the out breath to flex forwards. The in breath to restack. This movement pattern can be particularly challenging if you are rehabilitating from a disc issue. If that is the case, please work through your pain-free range of movement so you don't irritate your nerves. Your nerves can remember pain and they can get a little bit overexcited. And if you do something that stimulates what has caused pain in the past, your nerves can respond with the remembered response of pain, even though the issue that caused the initial pain is no longer a problem. Last time through. Okay, so we're moving from our spine stretch forwards. We're going to lie ourselves down on our back. I would advise that if you find that when you lie on your back, you get what we call chin poke, where your chin sticks up into the air like this. If you place a small pad underneath your head, that should bring the neck into neutral and the face into neutral. When you're in a chin poke position, your neck is in hyperextension and that is not a good position for your neck to be in, okay? So please do correct if you need to. Let's bring pelvis to neutral so that the three bones at the front of the pelvis are flat and level to each other. Lengthen the collarbones, press the shoulders back and down, and then lift your legs into tabletop position. So your knees are directly above your hips, you've got a right angle at the knee. Alternate toes, dipping to the floor, moving from your hip joint, maintaining the 90-degree angle at the knee. Also maintaining your pelvis and your spine in neutral as your toe dips to the floor. The temptation here will be for your spine to extend and for you to use your back muscles like this, rather than making the muscles of your hip do the work with your toe dips to the floor. The muscles of your core are working to hold your pelvis and your spine in the neutral position. You may not quite have the strength to dip all the way to the floor, which is fine. You can go part way down and then come up, part way down and then come up. We make these our last two. And we're moving into an exercise now that is focused on thoracic mobilization. Placing your feet on the floor, glue your feet together and your legs together. Take the arms a little bit wider, palms down. Moving your pelvis, your legs and your feet as one unit, rotating to the side and back to the center. Your aim is to keep your feet and your knees together while you rotate. Your head and your shoulder blades on the ground. Although you will have quite a big range of movement here that you could potentially go to, please don't let your shoulder blade come off, okay? I would like you to work this one through a small range on purpose, maintaining your shoulder blades and your head on the floor. Last time to each side. When you come back to centre, separate legs to parallel, bring arms back, down by your sides and move into your tabletop position. The exercise from tabletop will be heel glide. You're going to glide one leg out until it's straight at roughly a 45-degree angle before gliding it back in, changing to the opposite leg and gliding in. Just check the way that your legs are tracking. We should have a straight line from the hip joint to the knee joint to the ankle joint. Please be aware if your hip wants to do something odd, like bringing the knee out to the side, so that your tabletop, your knees are wider than your hips. Correct it if you've noticed that going on. The reverse may be true, so you may have noticed your knees coming together or just one knee rotating together. So you've got into medial rotation of the hip joint. So think straight lines, hip joint, knee joint, ankle joint. Work to keep the straight lines as well as working to maintain the neutral and keep the abdominals strong. Last time. Releasing to the mat with the feet. Lengthen out to full body stretch. Notice how the spine extends in the lumbar region as a normal part of that movement. If your shoulder joints function as they should do, you will be able to keep your elbows straight and get the backs of your hands and your wrists onto the floor overhead. If you've any restriction in your shoulder joint or your thoracic spine, you won't be able to do that. It would be worth practicing some exercises every day that will help to stretch into your shoulder joint and your thoracic spine if you cannot get your arms over your head. Let's challenge the core with Pilates 100. Release the arms, come back into your crook lying position, pelvis and spine neutral, lift legs to tabletop. Any neck issues, please keep your head on the floor. If you're free of neck issues, chin tuck, lift the head, the shoulder blades and the arms off the mat to the top of the out prep. Load with one leg out. If you're feeling strong, you may want to take them both out. 50 beats, breathing, in, 2, 3, 4, 5, out, 2, 4, 10, in, 2, 3, 4, 5, out, 2, 3, 4, 20, in, 2, 4, 5, out, 2, 3, 4, 30, in, 2, 3, 4, 5, out, 2, 3, 4, 40, in, 2, 3, 4, 5, single legs, change over, breath, in, 2, 3, 4, 5, out, 2, 3, 4, 60. Again, the lines are important. Ankle to knee to hip as a straight line. Out, 2, 3, 4, 70, in, 2, 3, 4, 5, out, 2, 3, 4, 80, in, 2, 3, 4, 5, out, 2, 3, 4, 90, in, 2, 3, 4, 5, out, 2, 3, 4, 100. Tuck in, rest down. Stretching off the hip flexors. Bring one knee towards the chest, hip, knee and ankle, straight lines. Pelvis tilts backwards as you bring the knee in and your lumbar spine will flex, flattening to the floor. Feel the leg is long and straight. Releasing to change over. And bring the other knee in. Again, hip, knee and ankle. Keep them straight as they come in. The same is true on this long leg as it lengthens out. Hip, knee and ankle in straight lines, please. Notice whether this leg has the tendency either to roll in or to roll out. And try to have your kneecap and your toes pointing to the ceiling to maintain the parallel position. Release. Let's balance up our side facing exercises. We'll start with the side bend at the prep level. So you want to position yourself so you're on the opposite arm this time. Bottom knee on the mat, top knee to the ceiling, top foot in front of bottom foot, wrist on the knee. The out breath takes us up and over, performing a lateral flexion of the spine and dynamically loading that shoulder through range of movement. Twice more. And final one. Releasing down to sideline rotations. Place your pad underneath your head. Bringing the knees up at a right angle. Side lying in neutral, the elbows flex for the open door arm line. Reach the arm. Rotate. Pause for a breath in. And breath out close. Reach the arm. Rotate. Pause for a breath in. Breath out close. Reach the arm. Rotate. Pause for a breath in. Breath out close. This time we're going to breathe into the stretch. We're going to hold it. Reach the arm, rotate. Hold it there, breathe. Try to relax into the stretch without compromising the knee position. One more cycle of breath in and out. And release, returning. Stretch the front of your thigh following your rotations. Holding your foot or your ankle, move your knee backwards. We're looking for that straight horizontal line from the knee to the hip joint. If you do notice that your knee is sticking up out of the horizontal, bring it down. You may even want to try to move your knee back a little bit beyond the line of the hip to make this stretch more challenging. Releasing. Bring the knees back and prop yourself up onto your elbow. Side plank prep. We lift the rib cage up, bringing the spine into a straight line. We bring the pelvis off the mat and we reach to the ceiling. Hold this if it's the right level for you. Make it a little bit harder. Extend the top leg at the knee, taking the inside edge of the foot to the floor. Making it hardest, extend your bottom leg, taking the outside edge of your bottom leg to the floor so you're in your full plank position. Please choose the appropriate level to work in for this exercise. And we'll be holding for 10 more seconds. Count it down. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Well done, release down. Single leg stretch into crisscross obliques. We'll lie down on our back. If you do need a head pad, please use it. And we'll be working on strengthening the muscles into our abdominals and our waist. Find your neutral. Wrap into your core muscles. Pick the legs up to tabletop, making sure that the parallel lines are there. Hip joints, knee joints, ankle joints. Any neck issues, please keep your head down. If you're free of neck issues, tuck your chin, head, shoulder blades and arms off the mat. Single leg stretch, we reach. 1, change, 2, change, 3, change, 4. Keep going with the leg changes. Again, it's a straight line, hip to knee to ankle. So watch what your legs are doing, particularly on the return. And notice if your knees want to either come in, rotating medially at the hip joint, or go out, rotating laterally at the hip joint. The parallel is important for muscle balance. To transition into the obliques, we are going to keep the legs going. Place the fingers behind the ears, and as the knee comes in, we twist the opposite shoulder towards it. Our pelvis should stay still. So all we've done here is added a little bit of thoracic rotation. Your thoracic spine is your upper back, where you articulate with your rib cage, okay? So pelvis itself is staying really still. When you're doing the obliques, the movement is small. We're counting down. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Tabletop release. Place one foot on the floor, hold the back of the other thigh, and extend the toe to the ceiling. Draw the leg to you until you feel the stretch in the hamstring. Hold the leg there. Please remember, when you stretch your hamstring, you should have a gap between your back and the floor. So you should still be in neutral spine and neutral pelvis, and you should not do this, okay? So here my pelvis is lifted, my lumbar spine is flexed. Your hamstrings attached onto your sitting bone and onto your lower leg. So you try to take those 2 points as far away from each other as you can. You have to have a curve in your lower back to do that. Release and change sides. The stretch should feel slightly uncomfortable but not unbearable. I'd also like you to notice if when your foot goes up into the air, your chin goes up into the air like this. And if it does, please rock your head into chin tuck to correct your position with your neck. Working on buttock strength, we'll be hip lifting to the top of the bridge and performing a set of 4 arm scissors while we stay in bridge. To help control your knee position when you're in bridge, if you do have a knee squeezer pad or the big block, pop that between your knees. If you have been using a head pad, reduce it or remove it. So you push into your feet and clench your buttocks to lift the hips to the top of the bridge, and that should feel like you've got a straight line from your knee through your hip to your shoulder. Holding the straight line, we scissor the arms, reaching 4, 3, 2, 1. Release the arms from the scissor, place the pelvis down and lift back up again. Arm scissors. 4, 3, 2, 1. Release the scissors, place the pelvis down, pick it back up again. Arm scissors. 4, 3, 2, 1. Release the arms, release the pelvis, pick it back up. Arm scissors. 4, 3, 2, 1. Release the arms, place it down, pick it back up. Arm scissors. 4, 3, 2, 1. Release the arms, place it down, pick it up for the last time and scissor. 4, 3, 2, 1. Release the arms, release the pelvis. Lovely work. Okay, we'll remove the block from between the knees. We're going to be working on pelvic tilt next, okay? And this is the movement pattern that we are working to achieve. To make this a little bit harder, try your pelvic tilt with one leg at tabletop. To make it harder still, both legs at tabletop. To make it hardest, Both legs extended. And you're aiming to try to peel your pelvis off the mat in all instances. This becomes the prep for the rollover. Last time. And release it. Now we're going to work in our ab prep range. We'll be using an exercise called teaser prep, holding the pelvis and the spine in neutral against the weight of one leg as it is extended out, and also against the weight of the arms as they are extended. So we reach to the ceiling as we tuck the chin, lift to the top of the ab prep. Holding the ab prep, we move the arms back by the ears, and this is where the muscles in the abdominals start to work. And then we release the head, the arms back down. So it's chin tuck, point to the ceiling, lift the head and shoulders, reach the arms back by the ears, making sure you don't lose any height, release it down. Chin tuck as we reach, lift the head and shoulders. Keep the head and shoulders lifted, move the arms back in line with the ears, you can feel the work in the abs, release it down. Chin tuck and reach, lift the head and shoulders, arms back by the ears. And then when we release down, let's change legs, bringing the other leg into the air. We chin tuck and reach, lift the head and shoulders, reach the arms by the ears, releasing down. Chin tuck and reach, lift the head and shoulders, arms back by the ears, releasing down. Chin tuck and reach, lift the head and shoulders, arms back by the ears, releasing down. Chin tuck and reach, lift the head and shoulders, arms back by the ears, and then when we release it down, we'll bring ourselves back to our reclined position. From there, let us take ourselves over through to 4-point kneeling. So if you roll yourself onto your side and then push yourself up onto your hands and knees. From our 4-point position, we'll take the spine into extension and tuck the toes under, lifting the knees off the mat as we push up and back, making the shape of an upside down letter V. Try to keep the arch in your back as best you can. We're going to stretch in standing, so from here we'll walk the hands back to the feet and roll up. And it's the calf that we're going to stretch first. From a parallel position, step back with one leg, making sure that both of your feet are facing forwards and that back foot doesn't rotate out, it doesn't rotate in. Your side on view should be this, front knee directly above your ankle as you push that back heel down. To move from calf stretch into hip flexor stretch, we lift the back heel up, bend the back knee, and then you're going to, on purpose, perform a posterior pelvic tilt, tucking the tail between the legs, and that will open into the hip. You'll get stretch into the hip and down into the front of the thigh. Releasing and changing over. Let's do those same 2 stretches but on the opposite leg. Start off with your calf stretch. Just check both of your feet are in alignment. If you do find that you need to move your back leg back a little bit further to feel the stretch, please do. And just be careful with this knee. Directly over the ankle is good, but pointing forwards over your toes puts a lot of pressure on the internal structures of the knee, so best avoid it if you can. Lift the back heel, drop the knee down, tuck the tail between the legs. Chest stays lifted, shoulders stay back and down as we get that stretch into the hip and the front of the thigh. And we release. Moving into hamstring stretch. Bend both knees, sitting down, straighten one leg and stick your bottom up into the air. So you should feel stretch now coming down the back of the straight leg. Maintain neutral. Avoid doing this when you're stretching your hamstrings. Because your hamstring attaches onto your sitting bone, you need the curve in your back. So you're sticking your bottom up into the air to keep the curve, and that should give you a nice effective hamstring stretch. Release it, change it over. Bending both knees, straighten out the opposite leg, stick the bottom into the air, feel the stretch. And release it from there. Stretching our triceps, I'm just going to kneel down. I'm conscious that there's not very much room in the camera directly above. Take one hand, place it to the back of your neck, and then you can either press the arm towards the head, draw the elbow towards the head, or if you have range of movement in your shoulder joints that you can interlink your fingers behind your back, please do that. Hold the stretch. Release and change it over. Placing the other hand in between the shoulder blades. Remembering those options. We can press the arm, we can press the elbow, or if you have the range on this side, you can interlink your fingers. Releasing the arms, we're going to stretch the chest. For this one, you're going to place your hands onto your sacrum, interlink your fingers, squeeze your elbows towards each other. If that's enough of a stretch, you can stay there. Some of you will find you'll get into that position, you won't feel anything, and then in that case, extend the arms forwards. And again, some of you might find that you can get into that position, you're not going to feel anything. If that is the case, what you may want to do here is your partial roll down, and that will bring the arms over. Gravity will act onto the arms there to bring them into a much, much deeper stretch position. So this isn't suitable for everybody. If you're looking at it and thinking, no, that's not suitable for me, don't do it. Remember, go with the level that's good for you. Let's release it from that stretch, and then we're going to stretch our all-important neck muscles, okay? So for this, I would like you just to draw your head back into chin retraction, taking your ear over towards one shoulder. The stretch should be on the long side of your neck. So I'm feeling this here, and I'm trying to create space between my ear and the top of the shoulder. You can imagine you've got a heavy shopping bag in this arm, this side that you're feeling the stretch in, and that will draw the shoulder down and increase the stretch even more. Or you might want to take the arm that you don't feel the stretch in and just apply a little bit of overpressure onto the head. And again, that will increase your stretch as well. To come out of this stretch, it's important that you release your overpressure, lift your shoulder, and then bring your head up, okay? We'll go the opposite way, so we retract, we take the head over to the side. This time, my heavy weight is in this arm. This is my non-stretch side. This goes onto the side of the head. So both of those things are optional, the heavy weight and the overpressure onto the side of the head. Again, it's important that you work at a level that feels uncomfortable but not painful with all of your stretches. We'll release the overpressure. Remember, you lift the shoulder up to release it back and give the shoulders a roll back. Now, I've been talking a lot about knees during our session and alignment of the knees. So we're going to finish with a wall squat, which is a brilliant exercise to strengthen your knees. And if you can do this every day, it will really, really help for those of you who do manage knee issues. So all you need is a wall. And what you're going to do is you're going to stand your feet away from the wall. You're going to place your back onto the wall, and you're going to just sink yourself down until you've got roughly a right angle at the knee joint. If the right angle at the knee joint causes you any pain, come up the wall a little bit, so it can be a working towards the right angle. Press the back of your head, your shoulder blades and your sacrum into the wall and push your weight into your heels. Tighten your thighs. Make sure that your hip joints, your knee joints and your ankle joints line up in a straight line. Pressing the arms back, we're going to hold this position for up to a minute. So we'll start our count now. So this is also good for our posture, because you'll also be working on the alignment of your spine as well as the strength in your quadriceps. And by trying to sit against the wall or squat against the wall, as we are doing, we did sit against the wall a little bit earlier in the class, but sitting against the wall, squatting against the wall, standing against the wall, they're all really, really useful things that we can be incorporating into our everyday life, just to help remind us where we should be with ideal posture and wake those muscles up. Good news is we've only got about 15 seconds left. More than likely you are going to be feeling those legs working fairly hard now. And we're on our countdown from 10, 9, 8, 7, 6, 5, 4, 3, 2 and 1. Okay, push yourself off the wall, shake out your legs and just have a little walk around to release it. Okay, great work with your session today, everybody. So do try to include wall squats, standing against the wall, sitting against the wall as part of what you do in your everyday life, because those three things will strengthen your legs and also strengthen your postural muscles without you even thinking about it. Great work. I hope you've enjoyed the session. Bye.